Hello, everybody. Welcome to Travel Again Reunion 2023. Mike, nice to
Ed,
see you.
good to see you as always.
Very good. Welcome to all of our Travel Again advisors, our special guests, and all attendees. This is the Travel Again Reunion 2023. Today, our agenda will be a look back at Travel Again. What were our goals and what were our accomplishments? What did we achieve? We'll take a look at our achievement report and look back on what we thought would happen versus what really happened. Also, we'll take a look at our brand new results for the June 2023 Confidence Index. We've run another survey and found some fascinating results of what's happening now out in the marketplace. We also will bring on a special guest, Dr. Ranga Sampath, Senior Vice President and Head of Center for Innovation and Diagnostics at Siemens Healthineers. We're really excited to have Dr. Sampath back, and so we'll talk to him for a while. Lastly, we'll bring back on the advisors. Thank you for coming back today, and we will talk through what you've seen, what you personally went through, and what professionally you've gone through, and what maybe we would do different and what we've learned. And so with that, Mike, I will turn it over to you, and we will start today with a look at Travel Again. What was Travel Again? What were our goals, and what did we really achieve?
Yeah, I mean, this all getting back together all really just started as a conversation between you and I. We were kind of reflecting back on the work we did before, and I was really curious just to see if a lot of the assumptions we made, during the heat of the pandemic, held up. And I'm very proud to say they did. I mean, I think as we go through this, I think there's still a lot we can learn from the work we did, but also then to do this updated view of traveler confidence against where we left off in the end of 21, right? December 21, we did it. We did that. We ran the confidence studies up through from the fall of 2020. Right in the middle of the pandemic, right up through the end of 21. Now we have that kind of benchmark, and now to look at where we are now, to see how much progress we've made, I think really will give us some really good insights into how well we're doing on our recovery. So overall, I mean, this is, I think, good timing, and of course, always great to get back together, reconnect. As much as everybody's back to being very busy. Good to reconnect and bring everyone back together for some insight and a little bit of perspective.
Yes, indeed. In our achievement report, we highlighted our policy advisors. You want to tell us about how that group came together?
Well, this is great. I mean, when we started it, we just did outreach to really our collective network, and the response we got was just phenomenal, both at a company level, individual level. I mean, clearly these individuals, dedicated their time, helped chip in and really bring their perspective as we wrote the initial kind of framework and all that went with it. But it was really, again, shows the strength of the industry, the way, as a travel industry, we all can come together.
And tell us about the framework and your perspective on where we ended up.
Yeah, so this was, I mean, again, really proud of the work we did here. The goal was to really try to get to something where we could have one set of kind of recommendations, a framework, something that we could go back to and communicate throughout the industry. Because even before the pandemic, when we were both at GBTA, we spent a lot of time, lobbying on the Hill and spending time representing the industry. And one of the things we would hear from legislators all the time, and executive branch and legislative branch, was, look, as an industry, there's no doubt of the impact of the travel industry on the economy, tourism, business, leisure travel, everything, how much it drives the economy. But it's really helpful if you as an industry really can come together on key issues and try to really get to the critical matters. And I think it was with that spirit we said, man, we're in the middle of something unprecedented here. It's devastating our industry. We don't need 19 different versions of that when we're going back to look for, aid, for support, for policy, for anything in the midst of all of this. We want to have a voice, but we need to have one voice, because, man, you got to remember the times too. It was so disruptive and so unsettling, and no one knew, like, no one had been through this before. We didn't have any, certainly in our lifetimes, right? So there was no guide to go by, no history to go by. So it was really important that we pulled everybody together and got to a kind of a common place, and we did that. And I think even with things now, where you look at this travel recovery formula and you say, "Wow, no kidding," right? But remember, context in that time, this was really helping to coalesce around, okay, what do we really need? Obviously we need the vaccines to be developed, and that was, the race was on to do that. We need testing, we need low cost testing, we need an ability to do rapid testing. And again, remember the times, there was no rapid testing, there was no anything. There was, all of that had to be put in place. When we talked about having a digital health passport, some way that you could really accurately and honestly show, were you vaccinated, have you taken the steps to make it safe for you and for your fellow travelers. Masks, of course, all the work that had to be done to airlines, hoteliers, everybody, about cleaning and protocol around that, right? And then the goal was to get rid of the quarantines, because at that point too, remember, everything was shut down. You were quarantined. If you traveled, you had to quarantine. You had to, go through a long, if internationally, what was it, 2 weeks? You had a long period you had to quarantine. It made it really almost, not almost, let's say, not impossible, but very, very difficult and challenging to travel anywhere. And all of this was about, how do we do this to rebuild traveler confidence so that we would get, and therefore, travel again, right? So the survey we did, I think, really was at the end of the day, was, again, another key part of kind of pulling together and trying to quantify where the sentiment was at from travelers, both leisure and business. Because it's easy to say, things like, make statements like, "Oh, I think, travelers might want to do it's not," but we needed to really be able to measure it. And I think this index really helped to do that, to kind of bring it together, show the differences between business and leisure travelers, show the difference between domestic, international travel, and also, like, really, we asked some really, at the time, not to say controversial, but real challenging questions about vaccination, about masks, about all the things that were very sensitized out there in the politically and otherwise, right? And a lot of missteps being made, generally. And now I think, again, we've gotten to a place where all that's settled. But boy, in the moment, it was very, very challenging.
Like,
Then
we also
yeah,
we
go
also
ahead.
brought together a number of associations. Do you think this played a role or had any impact?
Yeah, it did. I mean, I would say that once we developed this, I mean, we had this group of advisors who could help spread the word, but we really needed to get it out there into the entire industry. So we did the work to pull together all of the major, travel associations, cutting across all the different sectors of travel. Back to that mission. The mission was not only develop a message, but then also take that message and disseminate it to the industry, and really ask for the cooperation of all these entities to come together and say, both not just here, but in Europe, around the world, and say, okay, we need to use this as a common way that we're talking about, showing, we were like, no pride of ownership here. Take the materials, adapt it to your own, communication efforts with your members, with your communities, in whatever way you see fit. But the more that we could keep that consistent, the better chance we had about getting that message out there, broadly and consistently. And I think we, again, think we did a good job. And then the Champions Network was really just, expanding out individually throughout our networks, because we had a lot of support from just people, even if their organization or their corporation couldn't necessarily, put their name to something. It was still great to be able to have, as individuals, as executives, influencers, to lend their name and say, yeah, I'm going to take this and I'll go out and I'll help build, be spread the word. And when we got, I think we have more than 300 people, key contacts who really helped us get the word out. And then we focused on doing things like this, which was once the vaccines were developed and starting to, get root, and people were getting vaccinated, getting that one, but also their second, vaccination, depending on the brand they were using, right? That being able to just show and say, look, this is the difference in vaccination. Like, if you're vaccinated, maybe there's some hesitancy. Everyone had a point of view on this. But if you did get vaccinated, it basically created a whole different travel experience for you, as opposed to unvaccinated people who really, their ability to participate and and even just, like you said, the logistics of, the quarantining and everything else that had to be done. I mean, it really made it just a real night and day difference in terms of your ability to travel once we were getting more towards the end of 2021. Yeah, and then again, you and I, we tried to speak and get out there as much as we could. We got tremendous media coverage. Really proud of that too. We got national media coverage, a lot of help and support. And again, with that attitude of, is it safe to get out there? And what is the real sentiment? And a lot of outlets picked up the index and put that out there too, as a way to kind of say, here's a little, we got our finger on the pulse of the traveler. What are they seeing and what are they feeling through all this? So again, some really terrific work overall.
Okay, thanks, Mike, for revisiting all that. I'm going to bring up the June most recent survey, which will help us understand.
Says, here we go. Yeah. So we really, we took the same format, the same questions, but adapted a little bit, because now here we are, obviously, fast forward to 2023. But I think it really, I think it's revealing about kind of where we are, and I think reflects, very well on, I'd say the outlook, longer term outlook for the industry and recovery, and I think a good snapshot of where we are. This part, the phases of recovery, was really the, kind of the basis for kind of setting this out. Again, proud to say that, man, we were, I think, really on the mark about the timing and the phases and how it would play out. And I think, again, we as we're seeing now, we're really finishing phase one. Believe it or not, when you talk about this, you had a pre-recovery kind of phase where, again, so much was just uncertain. No one was traveling. Everything was locked down, to the next recovery phase. And at the time, you'd say, oh man, the end of 2023, that seems so far off. But here we are, we're coming up on it. And it's really, this is really holding true, right? That now the vaccination is not an issue anymore. We've kind of officially come to the end of the pandemic. The economy has found level ground, although again, not without some uncertainty and issues and changes in terms of the marketplace, interest rates, all that. But again, we're in a much stronger place clearly than we were before, even a year ago. And now we're also at this place where leisure demand, we thought, would really lead, and it did. We thought business travel would be slower to recover, mainly because you're talking about businesses creating budgets. You've got budgetary cycles. People weren't back to work at the office yet. So that was going to be a slower recovery process for business that was going to lag leisure. The interesting thing, we didn't really necessarily predict, and I think is playing out though, is that the meeting and event part of the business is actually coming back faster than the business travel. Because companies are getting their employees together in a meeting. You're having conferences and events are back and going strong, because people now they're working from home, but they still have to, and certainly in sales roles, have to get out and actually see their customers while they're going to events to do so, maybe not necessarily to their customer's office. So you've seen kind of a little change in the order of recovery this time around.
Right.
And as we gear up for phase two, which is now back to more of a normalized recovery process. Now that we've dug out of the big hole of, losing 80% of the market, now we're back to a place where we've got to get to the last 20, which is the longer, slower climb.
Okay, why don't we take a look at the results, Mike, and then
Yep.
as we do, walk us through some of the key takeaways.
Okay. Yeah, and we'll be releasing all these later today, tomorrow. All this report will go out, be available to everyone, and we'll get it out to the trade media and to media outlets to for release. But yeah, I mean, big picture, traveler confidence. As we kind of now know or have seen, this is really matching up, but I'm telling you, it really bodes well for future recovery as well. Leisure index is up over 4, which is, basically what we've seen. Leisure travel is back and booming, and it seems to be, keeping, the only thing holding it back more is capacity, in terms of the industry's capacity, which also drives price a little bit, or quite a bit, as airlines are rebuilding all their capacity and bringing it all back. You've got full planes, they're charging more. It's putting a little bit of a limiter on leisure travel in some cases, depending on markets. But, overall, confidence is high, people are back traveling. We'll see this as we go down through the numbers, some of the specifics about domestic, international, I'll come back to that. Business travel is back to, I'd say, the high mark of when we were measuring before. I don't think my inclination here is that this is really not about confidence in traveling. It's really more about the company's willingness or ability to send people, and from a budget perspective, from just like you said, people are not fully back to the office, so you're not traveling to see customers or partners at their offices necessarily. So I think some of that is more why that is a lower number than leisure. I don't think there's anything inherent about business travel that makes it more or less, people more or less confident about the actual travel.
Right. When do we look at some of the detailed results, Mike?
Yeah, so there's some good stuff in here for sure. One thing is that, so let's talk about business travel and why these are strong numbers that, again, are good for recovery. You can see where, certainly in the next 90 days, you've got in question 1, you've got a higher percentage, in that 1 or 2 bucket than we ever, had before in terms of travel. 75% of people have trips planned in the next 90 days. That's really good. Would people travel domestically for business? 85%. Internationally, a lower number, 62, but remember, look at, it's almost double where we were when we were in the midst of the Delta variant and a low point in the marketplace. So international travel is certainly coming back. Wait till you get to leisure numbers on this. So future reservation number really strong. This is also, again, budget driven, company driven, less about the person's desire or willingness to travel. And again, really strong numbers on, strong and much stronger numbers on confidence to travel for business travel. But I think the other side note, which I find really interesting here, is, this question. We wanted to ask it, kind of a COVID test related question, because we didn't want to leave that one go in terms of, even though it's not required now, what if we did have some sort of event, outbreak, something else that happened, what would be the attitude? And it looks like a very good positive one in terms of, maybe this comes in a bit to the learnings of people, business travelers saying, look, if I needed to take tests to travel and I need to travel for business, I mean, the overwhelming majority, 81% are saying, yeah, I'd do that, right? So that's a good sign. I mean, maybe a little bit of our learnings again, right? And acceptance in the industry. Nothing really too surprising about the confidence in travel pieces, because I think largely, again, we now expect the cleaning elements. The mask is optional, but people do wear them. But people are also, there's no stigma with, if somebody wears a mask, they wear a mask. It's not, it's fine. And then the other areas don't seem to be as important anymore. And on the quality of life issues, I mean, over 70% said that it's either COVID's going to have a less or same effect as, on my quality of life, and certainly for business travel. So good, strong numbers. Now let's talk leisure. Boy, talk about a booming, right? Look at these numbers. Would you, if you could afford to do so, would you travel domestically for leisure travel, like 91%. Again, reflects what we're seeing in the travel demand numbers, what airlines are showing in their earnings, what hoteliers are seeing in terms of their recovery. This number is phenomenal. The international leisure travel number is 10 points stronger than the business travel number. And I think partially too, because people are also seeing strong dollar value internationally, like wanting to get back to traveling again. I mean, all the restrictions have been removed. So we're starting to get, back to a place where people are, again, very comfortable traveling again. And again, all these other numbers really strong. You're at 73.5% saying, basically, ready, really comfortable, ready to travel. That's fantastic. And even a reasonably strong number on willing to take tests to make, the ability to keep traveling, for leisure travel, although less than business, right? And again, very, very strong numbers at the end. Over 80% said, COVID has less or same impact on quality of life. So overall, I would say good, strong numbers that reflect, I think that point where we're ready to pivot to the next phase of recovery. And good to see that, overall, we're seeing, that confidence largely rebuilt, in the last, and certainly significantly more in the last year.
Okay. Thanks, Mike. Obviously, we'll send those out and people can review them on their own, but it's great to have the highlights and be walked through. Now, I welcome our first guest, Dr. Ranga Sampath, Senior Vice President and Head Center for Innovation in Diagnostics at Siemens Healthineers. Ranga, it's great to see you. Thank you for joining us. You were so valuable to us during the pandemic, helping us understand where things were headed. And you moved from Find, where you were before, to Siemens, where you're working on diagnostic and testing. And so we'd love to hear your perspective. And over to you, Mike.
Yeah, so Ranga, again, thanks. And he, just so everybody knows, I mean, played such a valuable role for us. Again, you got to thinking of the times too. We were all learning on the fly, about and willingness to come in and also make sure when we were making recommendations that they were really grounded in science, right? And so it was really helpful, and you gave us a lot of your time, and again, we really appreciate that. I'm gonna basically start with maybe just a couple questions for you that are more just about kind of reflecting back, right, and on all of this, like kind of both personally and professionally, maybe a little bit of like what did you learn during this whole pandemic, and certainly talk about being right in the middle of it from a health and safety perspective. You were right on point with all this. Maybe a little bit of your perspective would be great.
Yeah, first of all, Mike and Ed, it's really a pleasure to be back here with the two of you. I would say talking more in a peace times, if you will, where we're able to reflect back.
Yeah.
3 years ago, we didn't know we'll get to this point, or what the state of affairs would be. Some of your survey and some of the predictions and all that, as you put the calendars up or the timelines up, it's remarkable how we, in a sense, we're partly hopeful, but partly sort of using the data that was coming to us to predict where we might be. And really, the May 2023 lifting of public health emergency is something that people have kind of taken in their stride as a non-event, but in reality, it's a big deal, right? If you sort of look back to where we were through 21, the uncertainty of will this ever come off, or public health emergency kind of notification, and all the restrictions that came with it, right? So it basically put constraints, some maybe more severe than the other, all through our lives, right? So in a way, I want to take a moment, maybe even to recognize that this was a big deal, and not just for the travel industry, but across the globe. My own personal reflections, and as you correctly pointed out, when this whole event started, at the time I was the chief scientific officer at PHEIC, which is a NGO based in Geneva, and we were in the thick of COVID response. And that's one of the reasons why I was able to talk to you more from a testing perspective. That was our entire purview, and what we had put in place was sort of framework with which to assess new tests that are coming out, which are coming out faster than the diagnostic industry had ever seen. Companies that we had not even heard of before, when multiple different areas of applications suddenly were producing tests. How do you know which one was real, which one was not? Which of these were effective? What kind of testing was needed? I mean, so we spent a lot of time creating sort of the early framework, of policy documents and other quality standards and so on that people used to say, okay, given this situation, what is the best for you to be able to test in different localities, or even within a nation, there might be multiple different areas of operation. So being in the center of that, what I was able to see was a lack of what we thought the years leading up to it, we were ready for a pandemic. We had heard of pandemics before. We have heard of flu, 2009 flu pandemic was the most recent sort of in a broad respiratory virus pathogen outbreak. But even subsequent to that, we had other, a bit more localized, perhaps, things like Ebola and Zika and all these things that were fresh in our minds, emerged. So there's a whole bunch of viral outbreaks that had taken place either locally in certain geographies or more broadly with the fear of spread. And a lot of systems put in place. What we learned was all of that was still inadequate. And the reason for it being inadequate is in some ways inexplicable, but some ways fairly, what one could have predicted. Inexplicable because a lot of money went into putting these systems in place. So you would say, okay, why didn't we think of all the possible options? But the scale with which upper respiratory, commonly spreadable, virus that effectively meant if you were doing something as normal as breathing, you potentially were producing viral droplets, which could cause somebody else to pick up the same infection you may have, which is the biggest fear everyone always talked about. The act of airborne or droplet spread of some of these pathogens much more severe than, let's say, a bloodborne, which may be able to be contained by isolation measures more easily. Right. So we learned that. We also learned that the testing and other medical countermeasure infrastructure we had in place were simply inadequate from the volume. There was basically the onslaught that all these health systems faced. And at the time, being in PHEIC, our purview was what we would call the low and middle income country settings, about 150 countries that sort of form the Sub-Saharan Africa, Southeast Asia, or Latin America kind of areas where we are focused, where testing had been a challenge. Getting adequate, appropriate, quality assured tests was something that we were working very closely with the local and national governments and also other foundations and so on. But take, United States or Western Europe or other parts of what you might call the higher income economies, where you didn't really think that we were short of testing. I don't think anyone before the pandemic would have, won an argument saying that we don't have adequate testing capability, looking at the number of diagnostic companies, number of diagnostic tests or vaccines and therapeutics, and ability to get any of these countermeasures, if you will. But no one anticipated the scale and the timing of all of this, not just the scale, but everybody going to the same health center at the same time. And we saw this in the first month of the outbreak. And I still remember being at PHEIC and talking to my, some of the colleagues in China at the time, and how they were being overrun by the volume of people showing up, and they had to put up temporary, tents for hospitals, right, and so on. But despite that, most other countries, the Western, more advanced countries, didn't react to it, thinking partly that it was like the previous outbreak, that it would be contained, it would never spread to our parts of the world in a manner of speaking. So when it did, and then we found that our emergency rooms were no better equipped to deal with the volume of people showing up for testing, was just something that we learned at the time that we were just not prepared, right? So that's where I think one of the biggest lessons is ability to scale up testing in a way that reflects the nature of the pathogen was definitely inadequate. But the flip side of that, looking back now, in some of the early lessons from at that time South Korea, but then implemented globally in many places, including the U.S., of being able to mobilize testing outside healthcare centers, being able to mobilize what you might call community level testing or testing in non-traditional spaces, including schools and offices and all these things that really took the burden off the healthcare system. So the healthcare actually could be provided to those who are critically needed. So this kind of a lesson sort of coming out of this is not that we're going to do every testing outside healthcare setting, but the fact that that's an option in certain cases gives us sort of hope that we'll be able to deal with these kind of challenges better if we have the right testing. Obviously, everything we started doing also had an impact immediately on our whole supply chain, all the things that we put in place. I mean, and some of you were dealing with this on a day-to-day basis. While I was dealing with sort of the testing side of it, you're dealing with the, for instance, travel industry, and others similarly were dealing with, not being able to ship things around. Planes weren't flying, ships weren't sailing, and ports weren't open, right? So all the implications that came with it. So there is, I think, a lot that we can look back and say, we did learn quite a bit. Are we prepared? We'll maybe continue this discussion.
Yeah, I guess that was my next question. It's like, and one we asked our advisors too, like, how ready do you think we are, like, for, and I think I'll kind of say it two ways. I mean, you could have I hate to, I'm not wishing this in any way, right? But what if you had, like, this fall, an outbreak of some variant, right? But then there's like a whole nother kind of way of looking and saying, okay, let's put COVID aside, something else, right? Would we know enough and learn, have we learned enough in terms of our ability to kind of mobilize, to communicate? Because again, even the communication was really flawed. I mean, as it would be. I mean, we were, everybody was doing this by the seat of their pants, like, as we were going through the process. You were learning every day, every week, learning something more, kind of dispelling rumors. There was a lot of misinformation out there, right, politically and otherwise, and which really worked against the process. But where do you think we stand on that scale, maybe as an industry and maybe just overall? What's your perspective there?
So it's in my mind, that is one of the number one both lessons learned, and I think where we maybe, again, let's take a look at the short to midterm, the next 1 to 3 to maybe even 5 years, continue to build on that sort of scale and response. I think we're in a good place overall, both the immediacy of the, sort of the coming out of the aftermath, knowing how severe this was, how it affected every industry. It is not one and everybody else was sitting around, pointing fingers. This was everybody, people were shut in their own homes, not being able to see, their own family, the elderly parents and so on. It impacted at a personal level, it impacted at a community, and obviously the industry and government level. So I think from a scale of response perspective, I think we can expect, I'm optimist, and I feel that we have enough short-term memory that we will be able to build on that, right? So the systems we put in place, or perhaps even the understandings and so on. But the bigger question is this something 10 years from now, 15 years from now, when perhaps through all the measures, just like, we say TSA, we don't hear about security violations or threats in our air traffic. Is not because none exist, it's just maybe because they're being controlled at the entry. Right. So maybe we are doing a better job for the next few years. Will we fall into a lull, as we did perhaps after the flu pandemic of 2009, right? Yep. When there was an increased alert, and do we just fall into a trap of thinking we're so good that nothing will happen? And that's the bigger worry than the scale. But you're absolutely correct. The scale, I think, is a key to being able to scale our response. I think is key to how we deal with this in the future.
Dr. Sampath, one thing we spent a lot of time talking about was the cost of testing.
Yeah.
And we had talked about that we thought it would drop significantly. I think you and I talked about it ending up around $1 or $2. I checked my local CVS the other day. It's still $25, $30 for 2 tests. Will the price fall at some point, or is the technology not there? And will that impact our ability to scale the next time?
So let's look at it. Actually, this is a question that as being in the industry, we grapple with, public health sectors grapple with, and so on. What helped us during the pandemic was, besides recognition of the criticality of it, was a response and the cost associated with it. So a lot of money poured into what you would call public health response, right? Both, vaccine wise, but also testing and so on. A lot of subsidies at the time to enable the test makers, where the cost of producing these tests was still, the amount of R&D that goes into it and so on. As a diagnostic engineer, I can tell you that it's not non-trivial to make some of these commodities, even when they get to the commodity stage. But how do we then make it accessible? And so, most of us benefited in many countries, and perhaps not true across globally, but in many countries we benefited from government, sending out tests, because what was realized was the cost of sending these tests to people more than made up for the impact of lack of testing, which really what caused us to shut down in the first place, right? So balancing between the cost and impact. But in a steady state, what I would see right now with the pandemic being gone and so on, there is no measure to really get to that point. We, as again, find where I was at the time, focused very heavily on the economies that are otherwise not able to sustain testing. And we've been working not just for COVID, but for tuberculosis, HIV, malaria, and all the other kind of tropical diseases that don't get adequate testing, partly because of the cost, to try and get those. So we were already in the mindset of getting, working with, companies through public-private partnerships, through foundations and so on. That is essentially money has to go somewhere, come from somewhere to go somewhere, to offset some of the cost of producing and distributing these tests. And there is significant amount of cost associated with it. That said, your experience and my experience today would be your CVS and Walgreens will not, obviously, they don't benefit from that kind of a subsidy coming from any organization. So there is a recovery piece of this cost, which I think will continue. The economies are, in somewhat dictating of these kind of testing opportunities and the quality that goes with it and so on. So I'm not saying the cost would not come down, but it's going to be a lot. It's a kind of testing that may be needed will determine, and not all testing are created equal or done the same way. Some of them do require more expensive ways of dealing with it. So that's, I think, part of the challenge, which I don't want anyone to assume that the way we were doing some of the testing during the peak of the pandemic will continue. Although in some ways, for outbreaks in the future, that may be what the first step is. How do we bring that sort of public resource component of it to prevent this from escalating? I still remember the early days when my daughter came down with what seemed like COVID-like symptoms. She was in the UK and then had to come home. And then 2 days after, she was, what perhaps was COVID, but we'll never know because there was no testing at the time. There was no way to test, right? I was dealing with all these test makers, but I couldn't provide a test to my own daughter, right? I knew that there's just nothing commercial. And I talked to my clinician, or we called the doctor, and they said, it sounds like she has COVID, but we can't do anything about it. Just keep her home unless she is not breathing and, oxygen levels are low, in which case we'll get her into the high, intensity wards, the ICUs, but that's not where she was. So in between, most of us got caught in this sort of not having anything to test. Hopefully, that's one of the key things we can sort of address early on. And what we may suspect to be a pandemic is how quickly can we get those tests in the hands of people who really need them. And I think some of the infrastructure we put in place, not infrastructure, but maybe the mindset that we can actually, people can do some of these testing, some of the easy to do testing with adequate follow-up, and maybe with some, some help or not from a healthcare setting, get better. so I think those are some of the areas where we can really improve a response.
Yeah, just picking up on what you're saying. I mean, I think, we've seen that, throughout history, and certainly not just in this or related to this, but in other ways, right? Where, like you said, I think you said it well. The awareness is there, but as time goes, right, the urgency and some of the attention fades. Certainly funding shifts to other things, right? And the longer it goes on, the less prepared. I mean, when we get the advisors on, we'll kind of that one of the wrap up question is about some advice for the future. Before we bring them on, though, one other thing I wanted to ask was just, in terms of the same issue about, having a really good testing, communication kind of framework in place. Do you feel like if it were to happen in the coming years, do you think we would be ready? Is there still a feeling of overall readiness, better awareness, or are we still kind of going to will we need to really, in some ways, kind of learn all over again? I mean,
so it's an interesting question, and just anecdotally, in 2019 December, I think the first week of December, I was along with several prominent leaders at the time. We were in Washington D.C. at a Institute of Medicine meeting where I spoke, and I read the transcripts of the meeting much later, and the prescient nature, I can sort of pat myself on the back, but everybody was saying the same thing, so I was not unique, is that the next time it happens, it probably will be a coronavirus, and it's unlikely that we are prepared because we don't have all the systems in place. Not because I knew anything at the time. 3 weeks later is when China first started, announcing they were having some viral infections, and another week before we knew it was coronavirus. But because this was sort of one of those, having experienced SARS, having experienced MERS, and knowing that part of the viral phylogeny was very poorly populated. People didn't know enough about the viruses of that type. So do we know everything we know? Will be foolish to believe that, because the next viral outbreak, if it comes from a different family, completely off the left field that we don't expect, we may have to do some of the learnings again in terms of how to respond. But more than how to respond, I think the how to respond, maybe we are better, but what to respond with, because we may not have the tools. Right. So what took the first 3 months in a testing industry, 3-4 months before adequate testing was available? Having the appropriate reagents, having the right quality of antibodies or PCR tests. PCR tests were a little sooner because you could do that as soon as you know the genetic sequence. You can do that. That's the advantage, but you can't distribute and scale PCR tests just as easily, even today. Right. So there is, so the pros and cons of all of these things. As soon as the fact that we have more sequencing capability now in some of the emerging countries, in Africa, we've showed up the sequencing capability, or in Southeast Asia, we're monitoring COVID pandemic, but the next pandemic, maybe we'll use the same infrastructure to find the genetic sequence, which means the PCR test may be sooner. And with that, maybe you can design some of the other reagents that are needed. It still takes time to scale up, but we were fortunate that we were able to get a vaccine out, by the end of the year, which was, phenomenal effort. Again, something that we need to take a moment to reflect on the history of vaccine. Right. That is the fastest we could do. But for the vaccine, we would not be talking about what we're doing today, much as the testing and all that improved, without that being a critical countermeasure to both build the immunity, but also give confidence to people that they can actually come out of this, right? And then the therapeutic came along. If there was a severe illness, you could actually perhaps respond to that with an adequate and a scientifically valid therapeutic, and not something else, right? All of these things build confidence. So I know that we can do it, but it required community to come together, or whole world to come together in some ways. Still, there were silos, and I won't say that we solved the human nature. We talked about political and other things which are not going to go away. In fact, they've become worse in some ways, and the false, spreading of false news and all that, especially with now the whole AI created, sounding real but not real information can be easily disseminated. So there are concerns that have also gone up at the same time, but I'm hopeful that recognizing the scale and impact, we do things better each time this comes around. That's is a sort of positive hope that I'll leave with.
So Ed, do we have some of the advisors?
We do. I will start bringing them on.
Okay.
And Mike, we surveyed the advisors a little bit. I don't know, as I bring them on, if you want to talk about the results of that survey. And advisors, I'll promote you to panelists, and then feel free to turn on video if you wish.
Yeah, we can. So we did send out to our advisors, some of which are going to come on and join, but really just 4 questions we asked each of them. One was, what's the most important thing you learned about the pandemic personally? What's the most important thing you learned professionally? And then to what degree do you believe that the industry's prepared for some major disruption? And then finally, what advice? And I'll hit on the first 3 with some of the advisors. Hey, Dean. And then maybe as a wrap-up question, we'll kind of do the future, talk about advice we can give to. I always think of like people coming into the industry. We'll have, by the time, hopefully we'll never have this again. But if we have some sort of disruption and or a different one, and just when we think we've seen it all, right, could be something else that comes along. There will be people coming into our industry in the workforce that will have none of this experience, or at least none of real, in memory, right? They would have been, maybe in school, but not certainly not in a position where they have to deal with it professionally. Hey, welcome, Bruce, Dean. So yeah, I think this is some interesting, it helps give some interesting perspectives. Kevin, welcome, Kevin. All right, anyone else joining, Ed?
I don't think so. I think that's it. And I think Kevin is just off video.
Our green room participants?
I believe so.
Well, yeah, you can unmute and come on board. Bruce, come on. So again, welcome and thanks for joining. And certainly the 3 of you were certainly very active in all of our initial work. And again, thank you for all your support during that part of the process too. So, a few things. I'll ask, just for the 3 of you, just jump in. Maybe some of the learnings. What did you all, as you reflect back, anything you want to share about, kind of personally or professionally, what your learnings were? Dean, Bruce, anybody jump in? Go first.
I think for me, I think I was, very comfortable with the science and stuff with my background. I think what I saw and learned was how important and critical the whole social discourse around an event and how much it played into making it more difficult, right? And kind of the whole, who's the authoritative, presenter of information, and we saw, real erosion in belief in science and to the extremes at times. And so really thinking about from a public, health communications, health emergency communications, we need a much better structure than just media and social media. And, it just was a complete mess. And unfortunately, I think, for many political reasons, our stalwarts like the CDC kind of just fell to the curb, right? Which also eroded trust. So I just feel like that whole area of, health emergency communications was not done well.
Yeah, that's a good point. I think, look, everyone was in so many ways, we were all certainly unprepared, right? And to your point, but yeah, I never, you made the point about, a lot of questioning science and that I really, that was something I probably wouldn't have had expected, to the degree that it happened. And so much questioning at a time when, certainly our science, our health and science community were just, working literally around the clock, to try to race to, not just to be even in a place where we could understand what a vaccine would need to do, right? And there was so much, questioning and the political forum was really horrible, and certainly here in the U.S. For that. And fortunately, again, we worked through it and got to a better place. But it certainly did create headwinds. When at a time when we need, every day we were learning something new. Kevin, Dean.
Yeah, I'll go ahead and go. Actually, my focus, of course, was Mike. I brought a lot of the leisure side of things, and
Right.
We talked through that. But I guess I'll start with one really positive thing, which I forgot to mention in my survey. But suppliers in general, travel suppliers, really did come together in terms of recognizing that unless they stand behind, like letting people rebook things and things like that, or give refunds, that we were really going to destroy a lot of value in the industry. So while there were certainly instances of people who were frustrated or maybe didn't have the experience that we would have liked, overall, I got to say, I thought the industry did a great job of that. For us personally, I will say travel insurance is a very finite thing, and it's regulated very heavily. You have filings and things like that, and language you have to abide by. One of the things we learned was definition of quarantine. What constitutes an actual meaning that you can't go versus you maybe shouldn't go, or it's up to you, but we recommend you don't, because insurance language is very finite. We definitely as a company err on the side of giving benefit of the doubt. Not all in the industry did, but also clarifying for people that while the requirements by country were very different, and Mike, this went to your definition of we had to really get it right about what do we need. Even though we tried to get standardized definitions by country, it was very much piecemeal in terms of whether you needed a vaccine, what the proof of vaccine was to go to certain places. And it made administering, for people wanting to travel, made it crazy. For travel insurance, trying to administer claims made it crazy. But one thing was clear is that fear of travel was not going to be a covered reason. So there was a lot of things I think we learned as an industry about, one, trying to be standardized, and two, very, very precise with definitions. I will say one of the interesting things come out of it, and it certainly is bodes from the numbers that Ed, you and Mike shared from leisure travel standpoint. Even though things that I see say that travel maybe hasn't, the number of trips haven't absolutely recovered to the level they were at in 2019, certainly closer on the leisure side. But I can tell you that travel insurance has more than recovered, because adoption, even though it's hard to exactly measure what that has been, people do recognize the value of insurance. And I would say even today, with as much as we're sitting here talking about, that COVID is no longer the disease that it once was, people are still not traveling for COVID, and we're still paying claims for that. People are still getting tested and not going because of that. But travel insurance adoption, I don't have exact numbers, but I would say has, if not doubled, it is certainly 80% higher adoption levels than there were beforehand, particularly on international trips, which obviously is good. But don't think that travel insurers are making money hand over fist, because you're still paying claims substantially. It is a higher cost now in terms of trip cancellation and things like that. So, but it was definitely an interesting time to be in the insurance business.
Yeah. How about Kevin? Anything to add?
Yeah. So, Dean and Bruce covered the travel side of it, business and leisure. So I'll just cover the meeting side of it. So the meeting side was just decimated. As you know, a lot of conferences were canceled, a lot of events, a lot of company meetings were canceled. Anything that gathered people together was definitely a no-no. So the meetings and events industry was literally obliterated for the majority of the pandemic. But I have to say I'm really proud of the way the industry responded in terms of not, it could have just sat there and done nothing, but, they recognized that, people collaborating and getting together was important. So even though they couldn't do it physically in person because of COVID, everybody started to look at technology to kind of bridge the gap until, things calmed down and there was some level of normalcy that people could return to. And, and so I really, a lot of the event planner folks are so adept at organizing these huge events as well as micro events and medium-sized events. And almost all of them had to resort to become like technical experts when it comes to like virtual technology, and things like that, so that collaboration tools, so that companies could still collaborate without physically getting together and keeping the business moving forward. And so that caused a lot of change, good change, I think, in the industry, because the industry was just kind of plodding along with very minimal innovation, being able to penetrate through, if it's not broken, why fix it type of mentality. And that just literally forced the whole industry to rethink the way they do things. And even today, the hybrid meeting, which to me really became of age during the pandemic, is now becoming a regular part of collaboration, right? So you have people now who are concerned about duty of care, for example, whether they're women or whether they're LGBTQ or whatever the case may be, that may not want to physically attend a meeting, a convention, or an event because of a state that it's being held in that has laws that might impinge on their freedoms. So you have to have a virtual component to include them and not exclude them. So I think the industry itself really took a gargantuan leap forward in normalizing, greater dependency on technology, to kind of continue the collaboration and the need for us to kind of, keep moving business forward while we're trying to sort out the toll that COVID was taking on, the general population. And Mike, you said something really interesting about in the data that I found very interesting, which is, the meeting side bounced back first. I also feel that while the technology helped get us through the pandemic, what it also did was it reinforced the need that human beings need to be together physically. And so once the coast was clear, it was literally like the gloves came off, right? And you had planners now arranging COVID testing as part of the protocol so that people can come, and and they had COVID related precautions being taken when it came to serving food and the accommodations, making sure that rooms are adequately cleaned and blah 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 blah. So in general, I was very proud of our industry because they were very agile in terms of making up for the gaps that were created by COVID and got us through the pandemic. And now that the pandemic is kind of winding down and people are feeling a lot more confident and safer to travel and get together in person. I still wear a mask, by the way, just so Ranga knows. I don't care if I'm the only one. I still wear one on the plane and at events. So I just went to MPIWEC and I had a mask on. I was the only guy with the mask. So I said, look for me, I'm in the mask. But I just really have to take my hat off to the industry because they really rallied and they really figured out a way to keep things moving and kept the economy going. And, I am not surprised at all. Like a conference I just went to, MPIWC, had about 2,000 people in Mexico. A year ago, that never would have happened.
Right.
Never would have happened. Right. And there would be a heavier reliance on virtual digital library type, content. This year was the emphasis more in-person gatherings. So that's what I have to say about the whole thing.
Well,
Thanks.
And I was gonna say, I think in terms of, the go forward, leisure, I think will continue to, stay at state pace. But I really do see, big events, conventions, that those forums, expos being a really, actually booming, just for all the things you described, because I think there's also you've got the changing mix about hybrid work from home, in office environment too. So again, there are very efficient ways to get together and to meet, be with your customers and all that. And I think we'll see, because in some cases you may not have, there may not be an office for you to go to visit,
Correct.
or whatever, but you certainly could, agree to meet there. And it was always good value, but now I think you're going to see, and to your point, also because there's more integration of the technology and tools, and
Right.
an evolution of what those events look like, right?
And I also think, Mike, what also impacted negatively the business travel side was you have C-level executives who, let's be very frank here, they noticed the millions of dollars in non-travel related expenses during the pandemic, and business still got done. Maybe not as best, one would argue, as when we meet in person, but business still kept moving forward, right? So the conversation, I find it very interesting when I talk to the biz travel sector, because the conversation moved from lowest logical fare to can't you do that via Zoom meeting?
Yeah.
You know what I mean? So it kind of, unfortunately, it kind of unleashed this recognition that maybe the trip needs to be kind of rethought. And then you couple that with all of the efforts around ESG and sustainability, and you quickly see how okay, so if we're trying to reduce carbon and carbon, business travel and meetings carbon is scope 3, which is like the worst polluters of carbon emission, right? You can quickly see that if they have carbon emission reduction goals in conjunction with cost reduction for travel, now I notice that they're going for travel that has value, that's not contributing too much to carbon emissions. So I think that has a real negative impact on the business travel sector. The leisure side, they're their own boss, so they're going to make their own decision whether to travel or not. But the corporate side has regulations and policies that are changing or have changed significantly because of COVID.
Thank you, Kevin. Mike, we are over time, but I want to give you the chance to ask one more rapid fire question to our panelists before we wrap up.
Yeah, so the last question is just the one said, like, words of advice, right? Just think in context of, you have new entrants coming into the travel industry. You've got, time has passed. What advice would we give? What any thoughts about how we could be potentially better prepared? Thoughts, any last words?
Well, I'm working with a number of companies in institutionalizing a lot of what we got to through this whole process, right? So to make sure that the memory remains and it doesn't just disappear, and 5 years from now or 10 years from now we go, I don't know. And I think the most important one that I see that's evolving over the last 18 months is really changing the nature of how we handle essentially operational risk and operational resiliency. And we broke down the silos during COVID as far as business continuity, emergency management, health and safety, all that stuff. Everybody came together, worked together, got solutions to deal with the pandemic, and again, bringing that together and institutionalizing it versus letting them go back to their silos. That's in full swing, and I see real structural changes that'll kind of harden and make that memory a reality.
Thanks, Bruce. Dean, same question to you.
Yeah. Besides buy travel insurance, which is now, I think, I like that we talked about the vaccines, which I think were critical. And Ron Guy, I appreciated the sentiments about how we've gotten better in terms of getting other countries to be able to sequence faster and things like that. I think those things will be key, because and consistency with definitions for entry and travel worldwide will help.
Kevin, answers from you?
Yeah, I just think that, some of these changes that were made because of COVID are, like it or not, are here to stay. So it's really, what I don't want to see is the industry going back and just kind of not pushing innovation and moving forward because they figured out a way to kind of make things work. And again, go back to that mentality of business as usual. If it ain't broke, why fix it? So I really loved what happened to the industry during the pandemic. If there was any upside, that was it. I just don't want the industry to go back to, okay, well, coast is clear now. Let's go back to the same old, same old.
Right.
And Dr. Sampath, same question to you.
I actually will take this opportunity to thank the travel industry, all of you leaders here, for bringing science into your decision making. And me being on this panel is a testament to that. You invited me in because you wanted to do decision making the right way and not the scientific discourse that we talked about, which was happening in the public channel, often uninformed or misinformed. So thank you for taking the time to follow science and the rationale and making the right decisions, all of which were tough. All of you faced, like everybody else, faced really tough challenges and had to make hard decisions, but yet you followed the right path. So I congratulate you on that, and really glad that we are here talking about it in past tense.
Dr. Sampath, thank you for those wise words. Mike, for bringing us all together, to our travel advisors and all of our attendees.
Wait,
Thank
I
you
have
for
one
joining
last thing. One last thing.
one last thing. You got it.
One last thing. Well, I want to get it in because one of our advisors put it in. He's not here with us today, but I don't think we'd have to. It won't be hard to guess who submitted it. He said, in the words of Herb Kelleher. So, so Dave Harvey, you've been outed. But Herb Kelleher said, "Manage in good times, so you'll do well in the bad times." Right?
Oh, very wise.
No truer words were spoken. Right? And probably
Yeah.
a good way to close out the session.
Absolutely.
Thank you, all our attendees. Thank you to our advisors and Dr. Sampath. Have a great day.
Thank you, everybody.
Thank you,
Bye, everyone.
Mike and Ed.